from the heart of our nation's capital, here's Family Research Council President Tony Perkins.
Well, good afternoon, everyone, and welcome to Washington Watch. Coming up for just the second time of his presidency, President Donald Trump addressed the nation from the Oval Office last night.
My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world.
The president striking the right balance of raising the awareness of a serious threat, but the assurance of a measured response. Dr. Ben Carson, Secretary of Housing and Urban Development, joins me in just a moment. Also, Congressman Michael Burgess, a member of the House Doctors Caucus, will join us later with the latest from Capitol Hill on action related to the coronavirus. And yesterday I spoke with Kentucky Congressman Thomas Massie about Governor Andy Beshear, telling churches to close, but no other public gatherings. Pastor Aaron Harvey, senior pastor at one of the state's largest churches, is here with his thoughts. The website, TonyPerkins.com. If you're on Twitter, it is @TPerkins. Also, check out the website, TonyPerkins.com. Piece today, an op-ed opinion piece on the issue of corona and how we ought to respond in the USA Today. You can find that at TonyPerkins.com. Joining me now is the Secretary of Secretary of Housing and Urban Development. I think immediately of the Department of Health and Human Services because of his work throughout his career in the healthcare field. But he is bringing health and happiness to HUD. Dr. Ben Carson, thanks so much for joining us.
So good to be with you today.
I want to get to last week, a hearing on Capitol Hill in which, again, we have some folks on the ideological other side taking issue with some of the policies that you are taking to protect the rights of faith-based organizations and women and children that utilize services that are assisted with by HUD. But first, I want to get your response to the president last night in, just for the second time of his presidency, speaking to the nation from the Oval Office regarding the threat from the coronavirus. Well,
obviously, I'm very happy that the president took the time to really explain the situation to the American people because a lot of fear is generated by uncertainty. And, we have come to learn quite a lot about this virus and how it behaves. And one of the things we've seen is that it has a relatively slow start, and then it has a very, very rapid uptick. Can go from, dozens to hundreds to thousands just almost in a week's time. And one of the things that seems to help is stopping the import of the pathogens. So that's why the president took this unprecedented action of restricting traffic from the places that seem to be generating the most viral load right now, and that seems to be Europe. It is actually taken over from China as the place that is producing the most disease. So by stopping that, then we only have to deal with what we already have as opposed to bringing in hundreds or thousands more people who can contact others every day.
Dr. Carson, I know you're part of the task force that the vice president is spearheading on the coronavirus. We've not yet seen the worst of it here in the United States, as I understand that we're on that upward track, probably a month or 6 weeks. We're going to see this, as I'm hearing, and we've had experts on the program talking about. Is this one where if you take the right precautions, and obviously people are responding, I think, very seriously to this. I mean, the hand sanitizers, the washing hands. If we take those actions, are we going to see that stemming the spread of this? Is the average person, if they take the right precautions and listen to the experts, how significant of a threat is it going to be to them?
Yeah, well, if we all begin to think differently, it will definitely have an impact. Will it keep it from getting worse? No, it's going to get worse. But maybe we can keep it from getting as bad as it would get. And obviously, if we can slow those numbers down, we have fewer and fewer contagious people, and it will begin to die down. So everybody should feel that they have something they can do. Even the people who are young and healthy, and certainly the data would seem to indicate that those people are not in great danger of death, but they might be completely asymptomatic, but still they're a carrier, and they can transmit it to someone else. And therefore, we all must take it very seriously and follow the guidelines that have been provided for everyone.
I want to play one more clip of the president's speech last night, because you've been, you are recognized for your groundbreaking work in healthcare. You've been at the top of the hierarchy of healthcare in this country. Play clip number 2. This is from last night's president's speech last night.
This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus. Our team is the best anywhere in the world. At the very start of the outbreak, we instituted sweeping travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection.
You've been around, as I mentioned, healthcare for a long time. Have you ever seen a response as intense, focused, and significant as this administration has responded to this healthcare crisis?
No, this response has been incredibly fast. It's very, very dramatic. And I think it has already had a tremendous impact, and one of the reasons that we haven't accelerated in the same way as some others have. But, we don't want to rest on our laurels and become, big-headed about this. There's still a lot of danger, and, we are going to have to be very, very vigilant. And people have to recognize that it's going to be some short-term pain, but short-term pain for long-term gain. That's really the...
Well, it makes absolutely perfect sense, and I think the administration has been aggressive in responding to it. And part of this is common sense on the behalf of the average citizen. And I want to go to the issue of common sense. I want to go back to something I mentioned at the beginning of the interview. Last week, you were before the House committee on the House Appropriations Committee. And you got into, actually some members, Democratic members came questioning a policy that you have as Secretary of Housing and Urban Development that just says, look, we're not going to let transgendered individuals into female shelters. If a man says he's a woman, we're going to protect these women. Oftentimes coming into these shelters as battered women, they want to be protected. And I mean, this is common sense, but this has become an issue with some members of Congress.
It has, and what I've said and continue to say is everybody has equal rights, but no one has extra rights. No one gets to trample on the rights of others, and that's what we're trying to protect. So there's an equal access rule, a law that was established in 2012, and it says that you can't discriminate against people on the basis of their perceived agenda or their LGBT status. And I don't have a problem with that. I don't want to discriminate against anybody.
Right.
I abhor discrimination. But at the same time, I don't want to say to a group of individuals, it doesn't matter what happens to you, because this special group here, I have to take care of them. That's why we have a brain, so we can figure out how we can take care of everybody without trampling on the rights of any particular group. And that's really what we try to emphasize. And we want people to do things in a way that actually makes sense.
Right.
There was an addition to the 2012 rule, in 2016 that said even in gender-specific shelters, you must take the word of whoever comes in there, even if their biological characteristics don't fit the description of the group that shelter is designed for. And this is where we take a little issue here, and we say we don't want to dictate from Washington, D.C., how a shelter which is gender-specific handles that situation. If they are male-specific, if they are female-specific, whatever specific they are, they get to decide who fits into that category based on the criteria that they have and based on what their state and local regulations are.
But this also could, if some members of Congress had their way, limit the access by reducing the number of shelters out there. Because bottom line, many of these shelters are faith-based, and they're going to operate according to a set of moral standards, and they also want to make sure that they're going to protect the women and children that are in there. And so they would basically be driven out of this ministry if they had to adhere to some of these rules.
They would, in fact, and that's one of the reasons that we want to push this back down to the state and local level, because when you do it that way, the people who actually live in that state and in that locality will have something to say about it at the ballot box.
Right. And this goes to, and you don't have to respond to this, but I want to state it, because this is where this administration is defending religious freedom and the ability to live out and practice your faith and use in your faith being a base to minister from. You are, and we're almost out of time, but I want to give you a chance to, because there's a project that you're working on, is to engage churches, faith-based organizations, to deal with homelessness in this country. So it's essential we protect religious freedom, because we're trying to engage them in a deeper way to solve a very significant problem.
That's correct. A few days ago, we met with a large number of pastors from all over the country, and we will actually be rolling out officially, very shortly, a challenge to all places of worship to adopt one homeless person or one homeless family with the goal of making them self-sufficient within a year. And I've already seen some examples of it in different places around the country. It is absolutely magnificent, because these congregations have a lot of expertise in them in lots of different areas.
Yes.
And when they adopt a person or a family, they're quickly able to find solutions that work and help to get these people into the right position. And what we have to recognize is, isn't that one of the real responsibilities of churches?
Absolutely.
If you look at James 1:27, it says, "Pure religion and undefiled before God and the Father is this, to visit the fatherless and widows in their affliction, and to keep himself unspotted from the world."
Dr. Carson, we're going to have to leave it there. We're out of time, but this is something we're going to want to talk about more as you roll out that program. Thanks so much for joining us today.
Thank you. It's been great being with you.
All right, folks, don't go away. We're back with more on the other side of the break.